bleeding on the brain and the elderly. So the question here is, why is it that we have immediate concern for our older aged patient group when they present to us with a fall, particularly in the light of trauma to the head, and the concern for a bleed on the brain, what we call an intracranial hemorrhage? In order to understand this, we give appreciation to a little bit of anatomy. Let's recall the fact that the brain is a lot of neuronal mass, so lots and lots of nerves. This brain matter is sat inside the brain. Rather than being sat, it's actually suspended, implying that it is surrounded, it is bathed in a fluid. The fluid, what we call CSF, cerebrospinal fluid. So it's kind of floating in the skull, but it's also suspended. It's actually hanging off the inner layer of the skull itself. So the inner layer of the parietal bone and the periosteal layer. And you've got the anchoring vessels, what we call bridging blood vessels. Now, we recognize the brain matter, suspended in fluid, CSF, anchored, hanging off the periosteal layer of the actual columarium. So what happens with age? We have a compromise to the composition of the bridging vessels. So remember, the blood vessels, as throughout the whole body, of course, and other structures as well, the structural composition, the structural component becomes a little bit compromised. So therefore they are not as strong, they are a little bit more brittle, and therefore more prone to tearing and breaking more readily, with less force and or trauma, physical trauma or force, than that which might be required in the likes of you and I, otherwise healthy young adults. Second thing that happens is that we get an element of cerebral atrophy, i.e. the brain matter itself reduces to some degree. Now this can be visualized on CT heads. We see it all the time. What's otherwise described on a CT scan by the radiologist as involutional changes. So as the brain matter reduces, it's a bit like muscle. The body says either use it or lose it. It's an extremely efficient machine, really, is the human body. Just like your muscle, either use it or lose it, you then get atrophy. The brain is exactly the same. Now going off on a tangent a little, I digress slightly. This is part of the reason we are seeing this emerging body of literature, which suggests that when you are preparing for retirement, be sure to take up an activity, a new activity where you are learning, so as to keep the brain stimulated and therefore prevent the onset of the likes of dementia. Coming back to the brain itself, so we've got the cerebral atrophy, a reduction in the brain matter itself, the mass itself. We've got the compromise to the structural component of the bridging vessels. And the third thing is the amount of CSF itself, the cerebrospinal fluid, the fluid in which the brain is suspended. If you get a reduction in that, then that's going to also cause the brain to sink a little bit and then add further physical tension to the bridging vessels. Again, adding to that kind of risk factor for them to break that little bit more readily because of the increased tension. So there you are, older population, greater risk of intracranial hemorrhages on the back of trauma compared to the likes of you and I, for the said three reasons. Of course, amongst a whole host of others, but these are the main three. Thank you for watching.